Hello, hello. Good day, everybody. We're just waiting for Dr. Harshita to join so that we can begin. Give me a moment. Okay. Um, as you're joining in, welcome to the Empowered Body, Mind, Soul community. Please drop in a hi, drop in your names, where you're from. I would like to know who all are joining in. So please drop in a comment as you're joining in. And there we are. We found Harshita.
Hello.
Hello, hello, hello. All right. So as you're all joining in, please drop in a hi and your name and where you're from and how you're feeling today in general. And yes, so on that note, welcome to the Empowered Body, Mind, Soul channel. We are here with the Doctor Meets Healer series. Empowered Body, Mind, Soul is a community for you to be a part of where you can learn a lot more about yourself. You can learn different techniques, different aspects of yourself so that you can make the best and most of your life. And that's why we created the Doctor Meets Healer series so that you can learn more about your health and how you can take care of it so that you can experience the best in life. Um, so, on that note, let me introduce myself before we shift it over to Harshita. I'm Manali Mehta. I am the founder of Empowered Body, Mind, Soul. I've been in the field of healing, training, and personality development for 15 years and more. And health is a very dear part of my own personal journey. So I like to learn, I like to strive, I like to, take the extra effort to make sure that people around me can also experience the benefits of good health. And so that's why we're here. So go ahead, Harshita, introduce yourself.
Hello, everybody. I'm Dr. Harshita. So, I'm a medical doctor, allopathic doctor, in fact, and I wanted more for my patients, especially when they were suffering from chronic diseases. And I wanted to empower them to be their own doctors so they don't have to be dependent on medicines. So, that's how I joined Empowered Body, Mind, Soul and started working with clients who have health issues. So, that's been my journey with Empowered Body, Mind, Soul. I'm very excited about how today's live is and especially today's topic. So I want to share with you all what will we be covering in today's Dr. Meets Healer episode 2. So the first thing we'll be covering is our personal journey with skin. Both of us have had our share of personal journey, so we'll be sharing our experiences with you. Second, how you can check your skin at your house itself without going to a doctor. That will be the second thing we'll be sharing. Third, from a healer perspective, what does skin issues mean? And then from both our perspectives, what is the root cause of skin issue from a doctor perspective and healer perspective? That's what we will delve into. And lastly, which you all wait for keenly, are the tips to take care of your skin from a holistic perspective so you're all sorted. So those are the things we'll be sharing in today's live. Share in the comments which is the part you're most excited about so we know on what we have to spend the most time with you all. So while you all are sharing that in the comments, I wanted to share with me you all my personal journey, how I have really combated skin issues. So technically, till my 20s, I've had no skin issue. I've had such clear skin, such glowing skin. In fact, people used to come to me and ask that. what do you do to your skin and what are you applying to your skin? And at that time, I would not have any answer. Why I would not have any answer? Because I wouldn't do nothing. And that's when I realized that when you have something already, you tend to take it for granted. And that's what actually happened to me. Once I crossed my 20s, I started getting acne, started getting facial hair, different kinds of issues. My skin, which was actually normal texture, started becoming dry and oily. It used to be fluctuating from different textures. And I actually have a tendency of touching my face a lot. So I used to end up popping pimples as well, which used to leave marks onto it. But then I gradually started working on, like, that's when it hit me that I need to have a skincare routine. I started with a routine, and then my brother shared a perspective with me, especially for acne, that treat them like a guest. Let them come, and as they are there with you, take care of them, and then they'll go back, making you look more beautiful. And that's shifted my perspective, and that's how I have been working with my skin. So now, do I have a perfect skin? Of course not, because perfect skin is a myth. You will know that soon. But I have a clear skin in a form which is a healthy skin, and whatever is happening with my skin ultimately is reflecting certain aspects which you will know in today's life. So constantly working on it. One thing which is definitely changes, now I have a skincare routine, and now I'm very gentle with my skin and not rough with my skin. So that's something which is shifted in my journey with skin. I would want, Manali, you to share what's your journey been with skin.
Great. So, as you said, till 20s, right? Your skin was great. Mine was also pretty much the same. Minus, I did have a lot of allergies that would, break out on my skin since I was a child. Like I would have like a sun allergy, or I would have rashes, or I would all have all of that. And whatever had to be done was done, but there was never really a permanent solution. And I did not really take it seriously because I was one of those kids who could not stay out of the sun. So I was always out, I was always playing, so it really didn't matter to me. And then when I hit my 20s, like about 23, 24, I started noticing that my clear skin started having all sorts of these red marks, bloody marks, and not just on my face. I would get rashes and bruises and heat balls and everything on the rest of my body as well. And it used to be a difficult time because I would not allow anybody to come close to me, not touch me, because it was an uncomfortable sensation. And you never know when something would pop and it would hurt and it would bleed. So I did a lot from a medical point of view, went through the tests, went through the grind, went through different kinds of doctors, did all of that till I don't know why, even though I've been in the field for 15 years, I did not take my own advice seriously. But then one day that tube light went on, and I'm like, you know what? Let's just do it my way. If I'm doing this for so many other people, why not do it for myself? It might take a little longer because I'm doing it for myself, because I have to figure things out. But when I started working on myself with different healing modalities and simultaneously working on the medical part of it and having a skincare routine as well, I saw a huge transition on my skin overall, not just my face, but my entire body. I've always had baby soft skin, but now it's at a completely different level. So I enjoy the skin I have right now. So even today for the live, I was like, you know what? People will put makeup on and come onto the live and everything. I was like, I'm just putting kajal and I'm just putting lipstick and I'm coming on just to look presentable that I'm on screen,
High
but I
five on
did
that.
not. Exactly. I did not want to put anything else on my skin. That's how we keep it real. That's how people will relate and they will understand what's actually happening. So, yeah. So, my journey with skin still continues. As you also said, I don't think my skin is perfect, but it's a reflection of me, who I am right now, and that's what matters. So here we are embracing our skin, not just the facial skin, full bodily skin, and let's get on to the journey of understanding what our skin signifies and what it can do for us, right? So go ahead, Harshita, let's start with a simple diagnosis sitting at home to understand the quality of skin that we have.
Yes. Thank you, Manali, for that. So, on our social media, we shared that 5 facts with you all. So, one of the first fact which was shared with you all, skin is the largest organ of the body. Let me tell you, that's actually a right fact. Skin is, in fact, the largest organ of your body. And being the largest organ of the body, two things when it comes to our five senses we don't miss out on is touching our skin and seeing our skin. So we'll exactly use those two principles to check our skin on a regular basis at our home itself. So start by, I would want you all to do, Manali can also do with me right now when she's there, and you all to do and share in the comments. Start touching skin and smoothly glide your fingers across all different aspects of your skin, starting from your face to the entire body, actually, all the regions of your body, your hands, your legs. We usually ignore the skin of different other locations. We focus a lot on facial skin, but go on and touch different parts of your skin and see while you're gliding your fingers, is it smooth finish or you're facing certain kinds of bumps or depression. That will give you an understanding if your skin is even, smooth toned, good quality, or if there are any bumps or depression. That means it's an uneven tone, there is certain break or certain outgrowth on the skin. That's where care and concern is required. You need to start looking deeper into it. So that's a sign and symptom of you that skin needs more attention. So that's how you do it with your touching the organs. So in case you have anything with your skin, please let me know in comments. Are you facing any bumps or depressions? And where beyond your face? Because I know with face everybody's gonna tell, but beyond your face, where are you facing that kind of quality in the skin? I would want to know that. While we're doing that, the second is looking at your skin. Like being the largest organ, that's the first thing we look at. The skin, how it looks. So start by, when you look at the skin, see if there is a kind of oiliness in the skin. Is there a subtle glow in the skin? Or the skin is actually flaking, especially around your elbows, around your knees, ankles, the joints. That's where you will see that the skin can slightly flake. There can be white kind of spots over there. So, flakiness in the skin indicates it's actually dry skin. There is dead skin on it, and that's where the skin needs little more nourishment. But when it's if it's glowing slightly, it's slightly more oily on it, then that indicates it's an oily skin. If you think that in your face your skin is oily and the rest of the body will also mean it's oily, no, that's not the truth. In fact, my own skin on my face, it's completely oily, but rest of my body, it's dry skin. So it's very important for you to look at different places of the skin and see how it is. Because if the skin is dry at one place, you will need a different routine for it. If the skin is oily at another place, it will require different products and different routine at it. So it's very important that you understand your skin, not just your facial skin, head to toe. Because being the largest organ, it covers your entire body. So head to toe, you need to understand how your skin is. So that's how simply you can do assessment of your skin right at home. So while you all are doing the assessment of the skin and putting down in the chat, I can see certain comments already into it. We'll look into it more. I would want you, Manali, to share that what really does skin signs and symptoms is from a healer's perspective.
Right. So, it's a funny thing because when I talk to my clients, either it's on video call or audio call, okay? I can immediately tell them on video call, it's obviously it's a little easier, but even on an audio call, I'm instantly able to tell them you've not been having enough water. Okay.
Mm-hmm.
And they're like, how do you know? You can't see me, or it's on video, you can't really make out. And I always tell them it's not just about what you're saying. It's about, it's not just about what I'm seeing on your face or what I'm hearing in your voice, but it's more about the feelings that you're expressing to me. Because every thought, every emotion that we experience is a reflection of something that's going on with us in our lives, in our bodies, in our entire experience, right?
Correct.
So when we look at the skin, if you look at it, it's like the whole world, and then there is you, right? So this body, this first level, your skin is your boundary, it's your safe space, it's your wall which separates you from the entire world, right? So when that boundary is getting breached, when you're feeling disrespected, when you're feeling like you don't like what's happening in your environment, when you're feeling very out of place and uncomfortable, your skin starts to react. Your skin starts to flare up, your skin starts to act up, your skin starts to give you these warning signs that, hey, I'm not comfortable in this environment. I am not comfortable with what's going on. Something is not making me feel okay. Something needs to be looked upon. It's like your first, warning sign. It's like get that ambulance bell going on in your head that, hey, watch out. Something's coming up. Either address it now or it's going to get worse. So when I look at the skin, I always tell people look at it on where your boundaries are. Boundaries, as in, are you able to separate yourself from people? Or do you tend to let people take advantage of you so that they invade your personal space? Or you are so afraid of people getting close to you that created such big high walls around you that everybody's pushed to a distance? All three versions are forms of boundaries. So understand what are your boundaries and you will understand what your skin is going through. So that's at an external level to give you a reflection, right, of what's going on. But Harshita, let's talk about what happens internally from the medical point of view, because the skin is just going to reflect eventually what's happening on the inside.
Exactly. So, like you said, that skin is actually showing the boundary. It's in fact covering all your internal organs of the body. So, it's actually meant to protect all the internal organs of the body. So, anything going wrong with the internal organs, it directly leaves an impact on the skin. And that's what actually the root cause is, that while you're working on your skin, but if there's something happening on your skin is actually telling you that there is something off with your internal organs as well. And that's where you go a little deeper onto the root cause of it. Like, let me share examples with you all so you can better understand it. Like, suppose somebody has punched you very hard on any of your body part, let's say for hand, and the skin has not broken. But what actually happens is you can see that after a while there will be a blood clot and it will leave different color on the skin. It can start off with being red, green, then the color changes over a period of time. What's that actually indicating? That there's actually blood which is clotted over there, but nothing has happened to your skin. But your circulatory system is actually gotten affected. That is an imprint which is left on the skin. So that's a point to note, that that's how one of the system leaves an impact. Second, when it comes to digestion, we right now eat anything and everything. We do not really have a control that, oh, I'm not going to eat this, I'm not going to eat this at this kind of time. We eat anything and everything. So when our digestive system is either weak, that it cannot digest everything we have had, or when the food itself is not actually good for us, your skin starts to look dull, your skin actually starts to look dry. Sometimes it can even leave acne. And that's what had actually happened with me. For me, I realized my acne's cause was my poor diet and sleep habits. So my diet was extremely poor and my digestive system was weak at that time. So that's why it had left an imprint on my skin. Only when I realized that did my creams which I used to apply started working. So that's how one another system leaves an impact. Then coming to third, if your hormonal levels are not in control, like how they are supposed to be during different phases of the day, during as you're growing, it can leave different kind of impact, from skin outgrowth, facial hair, different kinds of boils which are usually looking white, which leaves you with pus. There can be different kinds of impact like that. So every organ, these are just the top three examples which I've shared with you, which are very common, but every internal organ of the body, every sort of disease leaves an imprint on the skin. And that's why it's very important, even from a doctor's perspective, to not just focus on, if there's an acne, let me apply a cream and be done with it. Always look into how your internal organs are also working. So that's how physically you look at when it comes to a deeper perspective. Manali, I would like you to share that boundaries is, of course, how they know it at a symptom and a sign level. But what's actually happening at a deeper level from a healer's perspective, which is leading to skin issues?
Yes. So while I get into talking about what's happening internally, I would want people in the chat to tell what are you observing on your skin, or if you've had a period where you've had skin issues, anywhere on your body, put it down so that we can support you and guide you in having a better relationship with your body, with your health and your skin. So please definitely put it down in the comments. So as you were mentioning, there are different organs in the body and they're reflecting onto your skin as an outside perspective, right? It gives you what's going on internally. That's exactly what we look at when we're seeing it from a healer's point of view as well. Every organ, every part of your body is a reflection of a specific kind of thought process, a specific kind of personality quality about you, right? And so when something's going off over there, then something's going off in the relationship you share with yourself, and that's what gets reflected onto your skin. So I look at it as every morning and every night when I look into the mirror, when I look at myself completely, I also get like a complete diagnosis of how my relationship has been with myself on that particular day. Because if my skin is feeling dry, then it means I have not nourished my own relationship with myself enough on that day. If my skin is feeling oily, and not very comfortable, clogged, then it also shows that I have taken on too much inside of me and I've not given myself space to be. If my skin is inflamed or flared up or itchy, then it's giving me a sign that some emotion of mine is irritating me. It's making me feel uncomfortable with myself. So every time I look at my skin or I focus on my skin, it on constantly gives me an understanding of how I'm thinking about myself, what's going on with me, and what I need to do to work on my relationship with myself. And that's the best part, right? You have something tangible in front of you telling you, hey, you're not okay inside. Something's off with your relationship internally with yourself. And then it becomes easier for you to work on yourself and to work on the relationship you have with yourself. Um, so, yeah, if you want to have a good skin, have a great relationship with yourself. If you have a great relationship with yourself, a healthy one, obviously there will be highs and lows, but if you have a healthy relationship with yourself, you will have healthy skin as well. That's how simply I can put it. So I'm seeing certain comments. Let's address it from the medical point of view as well, Harshita, and then let's take it from the healer's point of view so people can get their answers on what's going on with their skin. Um,
Yes.
So the first thing I see is uneven, rough skin on the inner elbow, very dry skin on the heels. I'm seeing a lot of dry skin actually in general in what I'm reading here.
Correct. So tendency is that we will have dry skin or a slightly normal skin at our areas like elbows, knees, heels, and around ankle. Those are the places which comes frequently in contact with the environment, and that's where the skin texture is slightly different. So those are the skin which needs extra nourishment. I will soon come in my tips as well that how do you nourish your skin. So always remember, dry skin needs more nourishment. When it comes to oily skin, there is a different way. More than nourishment, it needs more cleansing. So oily skin focus more on cleansing, but dry skin always focus more on nourishment. So that's why I said skin at different parts of your body from head to toe is different. So it needs different kind of care. So that's the first step, that you have awareness that where your skin is dry. So now you know there you need to nourish more. We'll shortly come to how to nourish more. What are other
Okay.
questions, Manali? Can you let me
There is
know?
also on acne. So let me just tell you from the healer's point of view, dry skin, as she's saying, is about nourishment. So from your relationship with yourself, what do you need to nourish? That's what you need to keep in mind. Okay. So if you have overall dry skin, then you need to nourish the relationship you have with yourself. What does that mean? It means that you need to take time out, give yourself the personal time to take care of yourself, do what makes you feel comfortable, happy, and relaxed, right? If you have it in specific parts of the body, like Harshita was mentioning, if it's on the elbows, then you need to nourish the kind of personal space you give yourself. If you're not giving yourself enough personal space, your relationship with yourself is feeling very claustrophobic and interfered by with other people, your skin will start getting dry at the elbow level. And then if you find that your heels are getting dry or they're cracking, of course, it's a dehydration issue as well and a weight distribution issue as well. But at the same time, it also means that you are not feeling welcomed in your own life. So you need to take the time out to love yourself enough to realize that you really matter and you are welcomed into your own life and you're treated with a red carpet welcome. You are the hero, heroine of your life. So that's the experience you need to feel. So if there are any other specific parts where you're mentioning these skin issues, please put them down so that we can support you clearly on what's going on, right?
So one more thing which I want to add from physical perspective when it comes to dry skin, especially over the heels and the leg, it's also very important what kind of footwear are you wearing. It's important that you wear a footwear which firstly balances out your weight and all your parts are touching. So there are tendency that you will start seeing that the footwear which you're using regularly, you will see pressure points, and you will see sometimes that the toes part is depressed more, but the little finger and the other four fingers is not depressed more. That means you're not putting even weight. It's very important to put even weight, because if you do not put even weight, then you will start having pressure sores, which we in medical language call as con. So to avoid those kind of cons, those pressure sores, very important equally you distribute weight. One way to equally distribute weight is to consciously know it. Second, to always see your footwear and use a footwear which is equally distributing your weight.
Go ahead with the next part. A lot of people are mentioning also about acne in different parts of the body at different ages.
Okay. So acne, let me tell you, when it comes to first different ages, when it coming to acne is happening at different ages, the main reason of it is hormonal. So your internal organ, your hormonal system is going haywire. That's when different age group you will see different kind of acne. So it needs to be dealt like that. Usually the acne which is coming in childhood, let it be. It will settle by itself. It just requires the normal skincare which is needed. But acne which is coming in old age requires hormonal attention. It could be due to, in women especially, we see during menopause there can be a flare up of acne. During pregnancy there can be flare up of acne. Different phases in women, that's how it's seen. When it comes to men as well, as they're aging, different hormonal, when there is a dip in testosterone, there can be changes in acne as well as how your skin is. So if it's an older age acne is coming in, please consult a doctor so your entire hormonal system examination can be done, and that's when we will know what the root cause of acne is. That's when a different age group is happening. But if it's happening during different times, like of a day, or during monthly cycles is usually common to women. That's again hormonal. When it's happening at different monthly cycles, we usually see that before periods or mid cycles is when the acne tendency is more. That's again hormonal. So that's where your reproductive system and your hormonal system needs to be tested. So that is why it's happening. But any other time when the acne is happening, that's mainly to do with your hydration, with then again your diet. These become the two common causes when it's happening at different times of the day and different things. It's usually diet and hydration. So those are things which you need to look into. Digestion again from two perspective: eating good food and also seeing how strong your digestive system are. So that's how you go ahead and look at acne different times. What is it from
All right.
healer's perspective? What does acne mean? I know what it means. So I'm very curious for you to share with everybody, because that'll be a tube light moment.
Yes, so we consider the face area as the space from where we emote, right? We express our emotions from our face. So when you find acne on your face, it's actually a sign of a lot of suppressed emotions. And the ones which are really red and hurting and burning and all of that, those are specific kind of emotions related to anger, irritation, levels of, extreme levels of dislike where it can almost go up to hate. It's an extreme emotion that you are suppressing. You're holding back because you don't want to, you're too nice to basically speak up, right? So that's why you're holding on to it. And it's an emotion. It needs to come out somewhere. So it comes out on your face. So, whereas if you have it in the form of heat boils or acne forms on the rest of your body, it is also a sign of suppressed emotion, but suppressed anger and hurt towards yourself and towards certain relationships in your life. So, the more you recognize that I'm holding back on my emotions, whether it is about myself or another person, you need to find ways to channelize them in a healthy manner. And when you do that, you'll automatically see that your skin starts to settle and you'll find a sense of peace with your skin as well. So yeah, that's from the healer's point of view. Is there something else that somebody has mentioned about their skin that we missed? I
I
don't think
cannot
so.
see any new questions other than these.
Pigmentation.
Yeah,
So go ahead.
pigmentation. So, when you get skin pigmentation, especially at the places where you had acne earlier, or you had any kind of allergy earlier, or any other kind of disease earlier, that means that issue was not dealt with in a proper way. Either they was too harsh in dealing with that issue. Like, for example, I used to pop my pimples, and when I used to pop my pimples, it used to leave a mark. But if I've just left my pimples to be like that and just taken care of it by putting my creams, taking care of my diet, and it's disappeared on its own, then it's never left a mark. But if I've popped it always, it's led to bleeding. At times the pus goes out and then it flakes, and then it has always left a mark. And that's how my skin has gotten pigmented over a period of time when it comes to face. So if you've had pigments at any places where there was any other kind of issue, be it allergy, be it any kind of eczema, psoriasis, or kind of acne, that means the issue was not dealt with it properly. It was not being gentle. Second, the root cause is completely not being addressed. So for each of it, we've already answered what the root cause is. So dealing with it properly will let go of the pigmentation. So that's the first kind of pigmentation. But suppose there was no issues and a pigmentation has suddenly pop up. There can be pigmentation where your skin is actually getting lighter, and there can be pigmentation where skin is getting darker than what the tone is. So that's where the melanin pigment is getting disturbed. Either it's getting too less, skin pigment is melanin. That is what gives us the tone of skin actually. The darker tone or the lower tone, that's where the melanin pigment comes into play. So if it is just usually one or two very tiny spots, it's completely okay. It could be also because of how we're exposed to sun, different things we're using. But the moment the same spot becomes bigger or there are multiple spots, then definitely go ahead and consult a doctor so they can actually see what kind of a pigment it is and what's the distribution of melanin. And that's when the root cause will be known, and a proper plan can be created for you. So always remember, existing issue over there, pigment means different. But there was no existing issue. If there's pigment, it means different. So understand how to differentiate these two.
Great. That's a good perspective. Please, guys, always remember while we're giving you these simple tips at home, if it is something serious, please get it checked first so that you know where the root is. Because there are a lot of times we sit and we Google search things and then we do a self diagnosis, which might not be
Yes.
the most healthiest thing to do, which leads us into suffering a lot more rather than resolving something. So these are just simple things to guide you in the right direction. But if it is something that you are struggling with, which is becoming chronic, then please make sure you consult with a doctor first and you specifically meet up. And then you can always even, you can reach out to Dr. Harshita, you can reach out to me, and then we can work on it better. But these are just simple things to understand your quality, to give you that awareness of what's happening inside of your body right now so you can take care of it better and live a healthier life, right? So just to complete with that, from a pigmentation point of view, from a healer's point of view, I just want to add just a little bit over there is just like when you fall down and you hurt yourself and there is a wound, right? And then that wound kind of heals with time, but then it leaves a scar, right? So pigmentation is something like that. When you find especially darker pigmentation on your body, it is basically like a scar being left on your skin, that something has left you emotionally and mentally scarred. It is upsetting you, but you've decided, you know what, done and dusted. I don't want to deal with it. but it's still subconsciously bothering you somewhere. So it kind of becomes like a scar, a reminder that something has upset you, but you've given up on dealing with it. Okay. So, yeah, I think we've covered those questions. If there are any more, and if you're looking forward to any specific kind of solutions or guidance, please put them in the comments. And till then, Harshita, please go ahead. What is the tip, or what is the exact routine that one person should follow when taking care of their entire skin?
Yes, so definitely, like you mentioned, one thing for Google part of it, it's better to question here than to question Google, because here will be two experts giving you answer from a holistic perspective, so you will get multiple perspectives. But in fact, if you end up Googling, what I've heard the most is the first thing Google shows for anything of skin is skin cancer. So I do not want anybody to get into that anxiety and that trauma of even reading that. So refrain from Googling something like when it comes to your diagnosis. Once you've got your diagnosis, that's when you can learn more about it through Google. Use Google at the right time. That's very important. So yeah, coming to the tips, what needs to be done to really take care of your skin so you have a healthy skin. When I say healthy skin, not just the face, head to toe. I really will keep telling this multiple times. So I iterate this into your minds that your skin is head to toe. So always mention that the head to toe you need to take care of your skin. So two simple tips to begin with, and third will be the routine which you will start working on. First two things, which actually Manali said during her conversation that with clients, the first thing she says is that you're drinking less water. So that's where we begin with the drinking adequate amount of water. So I think this tip is something we've shared across our YouTube channel and all other social media. Every 20 kgs of body weight, 1 liter of water is what you need during normal climate. When it is winter, summer, or you're in AC, you need little higher water, but that's the amount of water which you need to drink. When you drink proper water, your skin will actually get hydrated, because remember, skin is the last layer of your body. So technically, skin gets last water. So whatever water you're drinking, the last one to get water is skin. But being the first layer, this is the first layer to lose water when it comes to sun or any other thing. So this is the layer which is losing first but getting last. So it's very important that you hydrate yourself. And if you're feeling thirsty, that means your skin is already dehydrated. So drink more amount of water, especially when you're thirsty. So that's the first tip. Second tip which I will give you all is exercise. When you're exercising, all your body muscles are getting activated. Because of muscles, skin is getting activated, and the most important thing is your blood is flowing through each and every cell of your body, and that blood which is flowing through each and every cell of your body will cleanse your skin, cleanse all the toxification. So technically, exercising is a great detox for your skin. So exercise, these are two simple tips to really have it on your daily regular basis. Keep doing this. Third, which is a little more important tip, and you will have to personalize this for yourself, is basically creating a skincare routine. So only three things you need in skincare routine: cleansing, nourishing, and protecting. So first step, cleansing your skin. Like I said, for oily skin, you need to clearly cleanse little more. So wherever your skin from head to toe is oily, please focus a little more on cleansing. How does cleansing work? It can be using a face wash, using a body wash, normal just using salt water bath. That itself is cleansing. Using any kind of soap. All of these are basically cleansing steps. The only purpose of cleansing is to remove all the dead impurities of the from the skin, any kind of dust, any kind of foreign bacteria which is on the skin. Using that, so using that kind of cleanser, please share in the comments what kind of cleansers are you using. If your cleanser says that it is also moisturizing, nourishing, throw away those cleansers, because we don't need those kind of cleansers. The only objective of cleanser is to just remove the dead skin, impurities, dust. So that's the first step. That's where you cleanse. But where it is dry skin, cleanse little lesser. So the amount of soap you would put, the amount of scrubbing you would do it little less, because it's already dry and dead. So that's the first step. So always in your routine, skincare routine, you need to have cleansing. Second is nourishing the skin. You nourish the skin both externally and internally. Externally is done through moisturizer, applying different kinds of serums, all of those things. And remember, this is not just for women. This is very much for all genders, men and women alike. you may need hair serums. So please do use serums if that's required, especially if the skin is dry. It does require little more nourishment. Actually, my grandmom has taught me this. This has worked very beautifully for me. Is using ghee. At times, some people also use oil when ghee is not available. But more than oil, ghee is what I have found to give best results. Especially if I actually have very dry lips, more than any lip balm, ghee has worked the best for me. And even in my elbows, till date, I actually apply ghee. So that's a very good way of nourishing your skin. Nourish your skin externally through moisturizers, serums, ghee, any kind of lubricant, basically any kind of like Vaseline jelly. Those are the ways you nourish externally. Internally, nourishment is good healthy food, green leafy vegetable food, different kinds of colors. That's how internally you nourish your skin. And at times you may need supplements also for your skin, because different kinds of vitamins are there. So if you're deficient in any vitamins, your doctor is prescribing any vitamins, those are the kind of vitamins you would need for your skin. Sometimes for age specific, some vitamins become necessary. So those would be the way to nourish your skin. Third step is protecting your skin. So now that you've cleansed your skin, you've nourished your skin, you've made sure that the skin has got its food, please protect the skin. So protecting the skin is one definite way, is using sunscreen. Second is also your clothes. Technically, your clothes are also protecting your skin. So if you're going out there or you're going in a dusty place, wearing a different kind of scarf, wearing a helmet, all of those are the ways to protect your skin. Just remember, as much as a barrier you can keep between your actual skin and everything external which is harmful, that's a way you can protect your skin. So tell me in the comments, what's your favorite way of protecting skin? How many of you are actually using sunscreen and different other methods to protect your skin? So yeah, that's your simple routine where you're cleansing, nourishing, and protecting. So please figure out from head to toe how your skin is and design that kind of routines, and you start following that routine. Once you start following that routine, you will automatically see over a period of days that how your skin is actually naturally becoming healthy and glowing. So that's a simple tip from a physical perspective and doctor's perspective. Manali, what is it from healer's perspective do they need to do to take care of their relationship with their self and in turn their skin?
Yes. So as you've already kind of discussed it, right? It's about how you're going to give yourself time, how you're going to have more awareness of your emotions and what's going on inside of you is the most basic thing to focus on if you want to improve the quality of your skin. So let's talk back. We did this last time also. It's about the relationship with yourself. So, how you treat yourself, how you deal with yourself is important, right? So, making sure that you give yourself time, even if it's 10 to 15 minutes in a day of just solid one on one quality time with yourself. And what you do in that quality time actually matters, right? If you're going to beat yourself up and worry about the future and worry about the tasks that you have to do and all, no, that's not what I mean. What I mean here is what you do in that time with yourself is just allow yourself to calm down, you know, just allow yourself to breathe. You allow yourself to relax. You allow yourself to unwind and just process how you're thinking, how you're feeling, how your body is making you feel. Just bring in that state of awareness. Allow that free flow state for just about 10 to 15 minutes every day. And that itself will be a massive change. Right. The second thing, irrespective of gender, all right, is acknowledging your feelings. I know in a lot of households, women are told you cry too much, you're weak, so they stop acknowledging their feelings. Or in a lot of households, boys are told that you're a boy, you can't keep talking about your feelings, but your feelings are your feelings. They represent or what's going on inside of you. So it's important to acknowledge how you're feeling. So you can either do it by journaling it, either by talking to yourself about it, or playing certain music which represents your emotional state at that point, but allow a sense of expression of how you're feeling. That's the second thing that I would say. And the third thing that I would say is just sit back, hold yourself together, and then just talk to yourself of how you want to love yourself, how you want to treat yourself, and how you want to get to know yourself, right? Which is something I would want to do just before we're going to end this live for about 30 seconds as a practice. But before we do that, if anybody has any specific questions about their skin, please put it down so that we can answer it for you. But to summarize, when we're talking about skin, it is an internal and external journey together because it's the largest organ of your body. So please bear in mind that you look at it from the internal point of view as well and the external part as well. Do not sideline either one. And I'm saying that from my own journey because I did it completely external for a couple of years. Then I went completely internal for a couple of years. And I was so angry with, the whole medical world and everything that everybody had to offer. And then I realized it was never about one against the other. It was a holistic combination of both together. So please make sure you take care of it both. So, Harshada, are there any questions that you can see in the chat, or else we can conclude with a 30-second exercise together.
Yes, there is just couple of questions. One is what was the wrong statement out of the five facts in the thing? So the fact number two, that the skin is made up of seven layers, was the wrong fact. Skin is just made up of three layers. So yeah, that's the answer to that question. There's also a question about pigmentation after the hysterectomy. So yes, pigmentation after hysterectomy can happen. It would now may need certain creams to address it, but usually what's happened is that the skin was cut over there, then the suture was put. So your skin being sensitive, the suture in the skin has not worked the best out of it. So that's where the pigmentation has led to. Usually any kind of friction, all of this can lead to pigmentation. So that's why it's happened. Can be looked into it at a maybe a discovery call, having a discovery call and seeing that can we answer this or not. It can at times can be resolved, at times it may not be resolved completely, so it can be looked at it at a one-on-one personal level. There's also a question on alkaline water. So alkaline water, I would suggest, is recommended only in few cases when it's different kinds of diagnosis, not like a general recommendation that everybody can have alkaline water. No, your body is actually a great balancer. It can actually balance different kinds of pH, different kinds of alkalinicity or acidity by itself. And in fact, at certain places, it is required to be acidic, because when it's acidic environment, any bacteria, any foreign body coming will get killed. So it's important at some places it's acidic. So never just go by general rule that alkaline water is the best or this water is the best. It is required and recommended in some cases. In some cases. So always consult your doctor or us and then take a call on that. So those were the questions I saw. Did you see any other questions which we may might have missed?
Mm, okay. When deep cuts or wounds heal completely, sometimes even after 2 months, a reddish mark is present at the spot of the wound. Is it normal medically, ma'am?
No, I was seeing reading another question. No, if it's completely healed by itself or by whatever the proper treatment has been given from the root cause of it, it will actually not lead a mark. There can be certain occasions, depending on a kind of severity of wound, how deep like the wound was in the skin, it can leave a certain mark. But usually, if you've taken the treatment, your doctor would tell you that will it heal completely or it will leave a scar. So most of the times, if it's completely addressed from the root cause of it, it will not leave unless until it was a very, very deep cut.
Right.
There's also a
Okay.
question where the flakiness around certain areas. Remember, there can be flakiness at different kinds of area. That's where again, remember that you need to give more nourishment. So flakiness is just indicating that it's dry and the dead skin has not been removed. That's from doctor's perspective. Anything you wanna add, Manali, from healer's perspective to any of the above concerns?
No, I just want to mention dry skin, especially we're hitting summer. So it is going to happen that a lot more people will experience dry skin. And that's what we also do during the summers, right? We tend to not really focus on ourselves. We tend to crib and complain about the heat, or we tend to run around a lot more in the heat without taking care of things. A lot of that happens. So make sure you take that time to pause and connect back with yourself, because in the summers we tend to get tired faster. We tend to go in that holiday mode, a lot of us. right? A lot of things happen, but we forget that there are things that are happening at the emotional and mental level which need to be focused upon on a daily basis.
True that.
Right. So I think somebody's also mentioned, like, for the dry skin specifically, please just stick to the routine from the medical point of view that Harshita has suggested. Okay, go through the fruits, not fruits. You said fruits. I'm adding fruits then. Fruits, green vegetables, and water, and then your cleansing, your nourishing, and your protection. That's from the physical point of view, and from the mental and emotional point of view, observe how you're not nourishing yourself. What can you do to nourish yourself, your personal growth, you as an individual, which makes you feel loved, taken care of, right? So keep that in mind, and that should set yourself in a right, good space, and you'll see the result in a couple of weeks itself. Okay. So yeah, I think we've covered the questions. Let's take about
Yes.
30 seconds, everybody, and let's just do a little exercise together. I want you to just, sit up, let go of your backrest, roll your shoulders back. If you have your feet on the ground, please kind of unlock them. And I just want you to bring both your hands onto your chest. Close your eyes and just focus on your breath. Just relax and allow your breath to take over. Breathe in gently and breathe out gently. And as you're focusing on your breath, realize that your skin is also breathing with you. So now feel that your entire skin is inhaling oxygen and your entire skin is exhaling all the toxins that you have. And as you're focusing on your breath, mentally tell yourself, I choose to learn how to connect with you. I choose to understand what makes you feel loved. And from this day onwards, I choose to build a loving, kind, positive, and free relationship with you. And bring your focus back onto your breath. And this time, inhale from your nose deeply. And from your mouth, exhale everything that's worrying you. Just let it go from your mouth. Blow out everything that's worrying you, everything that's bothering you, everything that's upsetting you. Take a deep breath in, breathe in that life, and exhale out all those suppressed thoughts and emotions. Just let it go. And just do it one more time. Breathe in love, life, happiness, and exhale out everything that's been upsetting you. Come back to your normal breathing. Bring your hands onto your chest and say, I trust you and I love you. Whenever you're ready, open your eyes. We went beyond 30 seconds, but I hope that was soothing enough. And that's how simple your process can be for you. Doing it once a day, doing it a couple of times a day, and you'll start seeing that your skin will also reflect the same experience for you. So yeah, that's us talking about skin health for all of you. If you found this useful, please make sure you share this with many people because everybody needs to take care of their skin. It's an important part of our body. And also, you want to feel beautiful when you see people around you, you want to see beauty around you. So, encourage them to take care of their skin. We can spread love that way. So, please go ahead and share this with everybody around you. Do these tips, follow them. Let us know as feedback how they worked for you as well. And if you need some extra support to deal with your skin, you can always reach out to us and we will be there to support you on a discovery call or through sessions or whatever you need. So please keep that in mind. And till we meet the next time, stay uplifted, stay empowered, and live life with a lot of love. Take care, everybody, and we shall see you next time. Bye. Have a wonderful day and a wonderful week ahead.
Bye bye. The doctor and the healer are signing off for today. Thank you.